Thank you very much, Alan, for this nice introduction. First, I would like to express my sincere thanks and gratitude for the organizing committee for this opportunity to be part of this highly reputable meeting in this highly reputable university. In particular, I would like to thank Alan for this opportunity. My name is Professor Fahad. I'm a professor of surgery. Currently, I'm the director of the Mycetoma Research Center in Sudan. I'm a surgeon by training, as well as a fellow of the Royal College of Physicians. I'm from Khartoum, Sudan, and this is the junction between the White Nile and the Blue Nile. And clearly you can see the White Nile, you can see the Blue Nile. The White Nile is here, and then the Blue Nile is there, and this is an anatomical junction between the two Niles. In fact, you have two junctions. One of them is anatomical, and one is physiological. Sometimes the Blue Nile is pushed back by the White Nile, how strong the Nile is, and sometimes the White Nile is pushed back by the Blue Nile when it's strong at that side. So you have, this is anatomical junction, not commonly you see it at this site. The objective of this presentation is to give a highlight on the activities and the achievements of the Mycetoma Research Center based on the knowledge we gained over the years and the knowledge management we had in this subject. The other objective of this presentation is to highlight the impact of this center on the mycetoma as a medical and a socio-economical problem and a dilemma worldwide and not in the Sudan. Hopefully during the coming few minutes I'm going to cover the establishment of the center, the justification of having a center like this, and then the objectives of the center, the achievements, and then the future plans and direction for the center. I am very much aware that a lot of you are not medics. Apology for showing you some picture which should not be appropriate, if you think. Mycetoma, it is a chronic specific inflammatory disease caused either by certain fungi or certain bacteria, and there's a lot of microorganisms are important in causation of this problem. Mycetoma is endemic in many tropical and subtropical regions in what is known as the Mycetoma belt. And the belt includes Sudan, Somalia, Senegal, South Africa, South America, and Mexico. In Sudan, the belt passes through the central part of the country, and the fungal type of Mycetoma is more common and more prominent. It starts as a small mass like this, and then gradually increase in size and metastasizes like this. It can be as miserable as this, it can be as malignant as this, and you can see how massive the problem is, and here you can see how malignant behavior, the problem, although it is a benign condition, and it can be fatal if it affected the brain of the human being. So this is mycetoma infection. The center was established in 1991 as a small clinic at the Khartoum Teaching Hospital. From there we moved to a small room at Sova University Hospital, and here is the center now. It's commonly seen in farmers, agricultural workers, and those who deal with the soil for a long time. This is the center from outside. Have a very nice, lovely garden. Sorry, the colors, the contrast is not very clear. These are the number of publications we produce over the years. This is the reception, patient reception area. One of the consultant rooms. This is the information center. All the data is computerized. I have a system for that. How miserable the patient is walking with a stick like this. This is the lab where a lot of work has been done there. This is the native treatment for the mycetoma. Hot bar of iron. Is the surgical part of it. Some of the investigation carried out. This is one of the hands of the operation. This is a native local treatment. This is the lab here, you can see. So this is a virtual visit. I hope you see you there, actually in the center there. The justification for this center are many. One of them that mycetoma is a common health problem in Sudan and in the region. Other important justification, mycetoma is one of the badly neglected problems in the Sudan as well as in the globe, around the globe. Because it is not a glorious disease like cardiac diseases or cancer or HIV infection. Even by medical profession, it is neglected problem. Again, because it's not a glorious disease. One of the important justification that it affects young patients. And most of our patients are less than 40 years. And you can imagine in a developing country where the life expectancy is not very high. Many of them, they have this problem. It affects young patients like this, and this young chap had a mycetoma of the brain. You can imagine the suffering of this young patient as well as his family. It will affect low socioeconomic status population. This is a lady coming to the clinic with this vehicle, amputated, and still she is coming to see for her follow-up there. Important justification that mycetoma end always with many centers with amputation like this. In developing countries, amputation, it is a social stigma. Patients have to rely on their families. They be detached from society. and they have to have a lot of support. And you can see this young lady, she is laughing, she is happy after the amputation because that was the end of a long suffering. As I mentioned, it has a high morbidity and can be fatal. Just imagine a problem like this in the brain of this young lady. And it can be massive like this inside the abdomen, affecting the bladder of this patient and have a problem with the urine and eventually can be fatal. This is the morbidity of this patient. You have to move like this all the time, with pain, with difficulty, and with disability. We have to rely on other members of the family, and that means that many of them, they be detached to the family here, and they have to be dependent on them. Eventually they lose the ability to be independent and be dependent on other members of the family at this site. One of the important justifications this is it is lack of health education among these patients. And imagine these patients have this problem for quite a long time, relying on local native treatment without very much use. And here you see this patient start to adapt himself with the problem. Even he started to shape his shoes to suit the problem in his foot. And it can be a preventable condition, mycetoma. The objective of the center are to have a good patient care, to conduct a sound research, teaching and education, and have a lot of community development activities. We have now more than 6,000 patients in the clinic that are coming regularly. And the good news now, the center is recognized internationally, and we're having a lot of patients coming from Somalia, from Saudi Arabia, from Ethiopia, Senegal, India, Bangladesh, and through the net, we have a patient from the state as well. The patients are offered medical education, health education, as well as treatment. We have a good number of well-expert personnel in the center there, and this is the medical treatment for all of the patient. You can see this massive disease at this site. Halfway through the treatment, completely cured after 1 year treatment of the patient at this site. You can imagine how long the treatment will take because this is a fungal bacterial infection. This is another patient after treatment, completely cured, a different person. How massive the problem is, 6 months later after treatment, she is almost back to normal at this site. Surgical treatment, it is one of the options given to these patients, and have a very good trained team for doing this. The center has generated an evidence-based treatment guidelines and protocols for managing the patient. Now this is used widely. The center was the first to invent the ultrasound diagnosis for the mycetoma infection. Again, the center was the first to use the fine needle aspiration cytology for the diagnosis of this problem. And the center again was the first to utilize the MRI for the diagnosis and grading of the problem of mycetoma. So these are the important breakthroughs in the diagnosis of the mycetoma came from Sudan and from this center. We published widely in clinical, basic sciences, epidemiology, and now we are published the 80 publication mycetoma in highly reputable journal internationally and regionally. The center had a good collaboration with the Erasmus Medical Center, with Newcastle University, other center in Utrecht, Cambridge University, and in Sofia as well. I'm glad to say that in mycetoma research now, these are the two big centers in mycetoma worldwide. Our center in Sudan and our collaborative center in the Netherlands in Rotterdam University. I'm glad to say that the workers in the center and their collaborators are the top now in the world in the area of mycetoma. We are using a lot of our facilities for teaching and learning of the undergraduates. This is a seminar at the medical school there. We have a good number of exchange program students in the center there. And we have a continuing professional development courses and activities. We have international workshops. We had the third and the fifth international conference in Sudan on Mycetoma. That was in 2002. And then have a lot of, this is the Minister of Health that time, Dr. Davida, addressing the opening ceremony of one of the workshops. One of the guests, social activities at the end of the workshop. It is a very common event there. We have a lot of international conferences and meetings locally. Regarding community development, we are offering the patient care at the places, health education, and visits to that area. This is one of the visits to the rural area. You can see two of the eminent professors in the field, seeing patients, advising on the management. And we establish clinics at the rural areas where people can come to be seen there, have the management and advice. This is at the end of one of these days. We go there and see the patient there. A gratitude from the local people there, field visit, health education. We produce a good number of leaflets, CDs, videos on the problem, trying to explain to the patients, the families, and the communities the problem, trying to encourage them to come early, to avoid local treatment like this. We have a good website, very educational, a lot of information there. And we have a Mycetoma support society. And you can see how miserable these patients. They are depressed, they are looking down, they have a lot of problems. So this society is trying to elevate their morale and boost their activities and trying to help them socially and financially. We had many visitors in the center. And this is one of the very nice occasions. We had almost 19 ambassadors in the Sudan. They came and visit the center to see the activities there, trying to help. How can they help the patient in the center there? We have a national control program that is in collaboration with the Ministry of Health, and this is this collaborative center or a program trying to eradicate mycetoma as a life-mutilating disease through 4 important issues: proper treatment, proper research, proper prevention, and proper education for the patients, the families, and the community. You will ask me about the budget of this center, and I will say no budget is allocated for this center. We are working with collaborative work with our group in Netherlands and other countries to produce this work, but I'm sure that we're going to have financial crisis ahead, but hopefully that will not take place. This is at the centers. We are collaborating with them internationally, mainly for research and other training activities and knowledge exchange, not knowledge transfer. And our future plan it is to have a go with the WHO, trying to see what is happening there. I'm going to Geneva tomorrow, trying to pursue the people there to include the mycetoma in the neglected diseases list. Still now, it is not included in the list of neglected diseases worldwide. I believe that this knowledge we gained was from the teamwork we had, and this is what we believe on it, and this is the center, and thank you very much for your kind attention.